Myasthenia gravis is a rare autoimmune neuromuscular disease that can significantly and negatively impact a person's life. And here to tell us more about MG, neurologist Dr. Tashin Mazufar and Nancy Law, CEO of the Myasthenia Gravis Foundation of America. Welcome to Lifestyles.
Thank you so much.
So interested in hearing a medical working definition for MG, Doctor.
Myasthenia gravis is a disease of the muscle, and it results in fatigable weakness. By fatigue, I mean muscle gets tired and becomes weak. So you start off with a relatively normal muscle, and then muscles get progressively weaker as you go through your task. So a good example of that is somebody who is in the middle of a meal, gets tired of chewing, and is no longer able to chew. Somebody who's talking and is no longer able to finish a sentence. Or a eyelid which is open, and with repeated use, the eyelids get droopy and the eyes close up on you. And that's the hallmark of this disease. If you have fatigable muscle weakness, that is myasthenia gravis unless proven otherwise.
And is it difficult to diagnose?
It is, and partly because it's a rare condition, and partly because it's a variable presentation. So patients may only have symptoms in their eyes. Patients may only have symptoms in their chewing muscles, and they may go to a specialist in that area. So they may go to an eye doctor, they may go to an ear and nose throat doctor, they may go to a pulmonologist if breathing difficulty is the only problem they're having. And because it's a rare condition, a lot of family practitioners, even regular general neurologists, may not be thinking of this disease, and that results in diagnostic delays, and unfortunately that results in therapeutic delay. This is a very manageable, very treatable disease. Even in the most severe cases, we can bring the patient back very close to what their normal status used to be.
Well, that is very good news. Nancy, share a bit of your journey with us. How did the symptoms manifest themselves in your life?
So I was diagnosed 22 years ago, and the first really noticeable symptom was I was at a conference and I was unable to speak. I would start a sentence and I couldn't seem to finish it. I had, I think, pretty much all of the symptoms as they continued to mount that Dr. Mazufar described. And I was scared. I knew something was going on. I knew enough to know they were neurological symptoms, but not necessarily what it was.
Wow, that had to be terribly frightening for you. Doctor, what are the treatments? You said this is a manageable disease. What can patients do?
Sure, it's an immune disease, and it's very important that we suppress the immune system to have a fighting chance of suppressing the disease for good. So you can put patients in remission for a long time. Unfortunately, we don't have a cure for it, and they may be at risk of having the symptoms back at some point. But again, as I said, you can make the patients a whole lot better. The mainstay of treatment still is steroid medications or corticosteroids, but there are a number of second-line drugs that are available. We use injectable medications if the patients are really severe or they have life-threatening conditions. And there are now injectable biological agents that we can use. It's also a disease where there's an incredible number of clinical trials going on looking at existing drugs or novel treatment options for treatment of myasthenia gravis.
Well, that is good news. Nancy, where can you send our viewers for more information?
Well, please go to the MGFA's website, myasthenia.org. We have a wealth of information about the disease. And also, Alexion Pharmaceuticals, who is helping with promoting awareness of MG during this month, has a site with tips and tricks for how you can best work with your doctor. And it's talkgmg.com.
Thanks to you both for this wonderful information. Appreciate it.
Thank you, Angie.
Thank you, Angie.
And we'll be back with more Local Lifestyle Friday.